What is traditional medicine? Part of the problem is that this is a complicated matter. There is no single, clear definition of traditional medicine. However, there is a huge variety of methods used to treat diseases. These methods are based on personal experience or knowledge shared over many generations. Although there is some good evidence from scientific research on the effectiveness of traditional medicines, people use traditional methods mainly because of their own experience, based on their own observations. This is, in fact, the only common feature of all the different disease treatment methods that we call traditional medicine. To help our understanding, it can be useful to divide medicine into three distinct groups. Folk medicine. Since childhood, people have used medicinal plants to treat health problems and diseases, often with great efficiency. In the Eastern Democratic Republic of Congo, the mothers of the Bashi people, for example, give their babies 2 or 3 drops of squeezed leaves of Tetradenia riparia when they have abdominal cramps. To treat fever, people look for leaves from the tree Vernonia amygdalina, commonly known as bitter leaves, and to treat intestinal worms, the leaves of the small herb Celosia trigena are used. There are 2 things in common with these treatments. The medicine of traditional healers for health problems that are difficult to treat. Patients seek help from people who practice modern medicine or traditional medicine. In many countries in the tropics, people have little access to modern medicine. In the remote northeastern regions of the Democratic Republic of Congo, where we work, there is virtually no infrastructure for transporting imported drugs, even though most patients could afford them. Given this situation, we started to ask ourselves if the local production of medicines from medicinal plants could be useful. We started by using some well-known plants to treat common medical problems, for which there was information about doses, effectiveness and side effects. Then, we created a vegetable garden and, with the permission of the regional health departments, we produced and used some herbal medicines. When there were no imported medicines, they are offered and used by patients or their families. They are free. Families exchange comments on the use of these plants without reservation, and there are no secrets about their uses. Some medicinal plants are also used as food, others are used only medicinally. Patients liked most of these remedies, and as a result, several medicinal gardens were created, with huge participation from the community. In recent years, the Democratic Republic of Congo has gone through very difficult times. Some health posts have been completely looted. In these cases, local production of herbal medicines continued, allowing these centers to offer their services again. A forum for traditional and modern medicine. We also encourage the creation of a forum for traditional healers, doctors and nurses, health service administrators, health and political authorities. Here, we discuss health problems and the contributions to health care offered by both traditional and modern medicines. Some aspects were very delicate. Doctors were skeptical about the efficacy and possible side effects of traditional medicine and questioned the fundamental ethics of this form of treatment. Traditional healers had learned from their experiences to be careful and thus did not want their treatment procedures to be investigated without the guarantee of protecting your knowledge. To the surprise of medical staff, they also complain about the low ethical standards of modern medicine in Angola. Follow our successes on our Beulah channel. We want to convince the whole world that traditional medicine is important. We need laboratories and your support. We want to distribute our laboratory-tested medicine all over Africa, but the West will also be healed if God wants it. Benefits of traditional medicine: reduce toxicity caused essentially by drugs, the environment, free radicals, inadequate nutrition, improve the general condition of the organism without damaging the organs, removing the blockages that affect their proper functioning, improve the patient's living conditions through food education adjusted to each person, treat the person in a holistic way, that is, see the person as a whole and not in a fragmented way. Treatments are free of side effects, reestablishment of the quality of life, and endow the person with a new philosophy of life. The natural products do not mask the disease. Remove it. Traditional medicine. Traditional medicine, MT, refers to the set of health practices developed before what is classified as modern or conventional medicine and which are still practiced today by different cultures around the world. Arab Manual of Phytotherapy, circa 1334. According to PAHO WHO, traditional medicine and the total technical knowledge and procedures based on theories, beliefs and indigenous experiences of different cultures, whether or not explainable by science, used for the maintenance of health, as well as for the prevention, diagnosis and treatment of physical and mental illnesses. In some countries the terms complementary medicine, alternative medicine or non-conventional medicine, and traditional medicine are used interchangeably. WHO 2000 Traditional medicine is a term widely used to refer to the various systems of traditional medicine, such as traditional Chinese medicine, Ayurvedic Hindu, medicine Unani, Arab and the various forms of indigenous medicine. It covers therapies with medication herbal, parts animal or minerals, and therapies without medication, such as acupuncture, manual therapies and spiritual therapies. In countries where the hegemonic health system is based on allopathic medicine or where traditional medicine has not yet been incorporated into the national health system, it is not distinguished from other aspects of traditional systems, either by its oral transmission of legends, where are updated values spiritual, ethical, moral, and significant historical events, either because it is characterized as empirical, practical knowledge resulting from habits consecrated by experience, unless it is associated with recognized professional medical practices, hegemonic or non-hegemonic, considered as plausible by modern medicine or scientific. WHO 2002. Arthur Kleinman's contribution in the field of medical anthropology, to distinguish traditional medicine from the knowledge of scientific health and the different peoples is remarkable. According to this author, an ethnomedical system and/or folk medicine is distinguished from popular, family medicine, practiced by all members of a community, from professional scientific, Western, cosmopolitan medicine or even from alternative and complementary medicine resulting from professionalization, of indigenous and traditional practices Chinese, Ayurvedic or non-hegemonic medieval Europeans, such as chiropractic, hydrotherapy, apitoxinotherapy, etc. This distinction can also be made by identifying popular practices and the techniques or forms of more organized knowledge, which can be described from the terminology proposed by Lewes 1988 as a medical rationality or logical and theoretically structured system, has as a condition necessary and sufficient to be considered as such, the presence of the following elements: 1. A morphology, anatomical conception, 2. A vital dynamic, physiology, 3. A diagnostic system, 4. A system of therapeutic interventions, 5. A medical doctrine, cosmology. In principle, non-professional religious folk medicine religious can be transformed into professional practice by various mechanisms of social legitimation, requires a specialist and a medical, sacred initiatic process of specialization, characterized by having schools, documents, teachers and disciples. Contact us Mikhael Massa, Akeke, Ezekiel and subscribe to this channel.